Well, there are about 306, 307 million people living in the 50 states and 4 million living in Puerto Rico. Would, Greg, making that health care formula at parity for Puerto Rico really change the overall cost of a health care reform plan? A lot.
Ultimately, it wouldn't. It's a very small piece of the equation in that sense, but the issue is who is receiving funding or assistance. If you're talking about American citizens, I think that no one would really argue with that. The question becomes, are you providing assistance to non-citizens or even illegal immigrants in this country? And those are the contentious issues in the debate, I think, that are potentially emerging. But I'm not an expert in this field, and so I would leave it at that.
But 4 million people who have a gross national product, if you will, that's smaller, an economy that's smaller, a per capita income that's smaller than any of the 50 states. Are we looking at spending a lot more money to cover Puerto Ricans like Americans living in the 50 states?
It would not add substantially to the price tag of the bill, is my understanding.
And my understanding is that the bill is that, at least as I understand the House bill, that there is an intention to expand the resources that are going through the formulas that were talked about in your clip. So I think that there is relief there, and I think that it doesn't raise the issue of whether it's citizens who are or non-citizens who are being treated. We're talking about Medicaid. We're talking about treating people who are
they're already in the system.
That's
they're
right.
already in the
That's
funding
right.
formulations
That's
because
right.
they're citizens.
We're talking about getting some more resources, which we can see are sorely needed into that system that is already serving people who are in. You're absolutely right.
Part of the issue is, though, the bill does loosen documentation requirements, which has been pretty contentious.
Go ahead, David.
As a Puerto Rican, first off, obviously there's an incredible amount of ignorance in Washington, D.C. and the nation's capital regarding the island. In many cases, we find that just like immigrant populations, Puerto Ricans, which they're not, because thanks to the Jones Act of 1914, Puerto Ricans have been citizens and have fought in every war, have been veterans in this country. And serve in the and inscribe in the selective service, they are a politically vulnerable population. They don't vote in Congress. That's the reason why they have not been able to get the parity in funding. It has nothing to do with documentation issues, because Puerto Ricans are citizens, and obviously there's a relative amount of ignorance that we're going to have to address as we deal with many legislators to address the issues of the funding disparities for Puerto Rico.
And can I just say, there's an interesting parallel to the District of Columbia, because we as a territory are often let out of this entire discussion and have fought very much for the same kinds of things. Puerto Rico doesn't have the advantage that at least we're in the shadow of the White House, but it's the very same kinds of issues where in this conversation, I can guarantee you in Washington, D.C., we have more undocumented immigrants, is my preference for what you call people, than in Puerto Rico. We happen to have a 70% match from the federal government for our Medicaid, which was fought for very heavily. When you have that level of poverty, you have to provide relief to that government to be able to provide health care. And increasing this match, what the federal government invests. So in DC, we put up, $3 and the government puts up $7. That has made an enormous difference in our ability to provide health care to, in the District of Columbia, 1 in 4 people depend on that. Puerto Rico and its health disparities are not much different. So
the match is even lower.
The match is far lower, and so it is critical, and it does make a difference. And it's, I think the one thing that you said, which is you don't know much about this subject, is probably more about your comment here, which is the fact that, you would say Puerto Rico and then say illegal immigrants just blows me out of the water.
What I was saying, to clarify my comments, was I was saying the issue is less about Puerto Rico and more about Medicaid funding in general and funding going to citizens versus non-citizens. Well, that statement wasn't applying to Puerto Rico specifically, but I was talking about that was the broader issue in terms of funding for in the program, and the
But
formulas.
even more broadly, I know we are talking about Puerto Rico, but even more broadly, I would question the statement. What we're talking about is improving the way programs work for people, for citizens, and people who are here legally.